welcome back to Lively. Today we're going to talk about a subject that is really close to my heart, OCD. It's an anxiety disorder that is pretty complex. OCD involves unwanted thoughts, so obsessions, and repetitive behaviors, compulsions. Compulsions are responses to obsessions. Now, OCD is not just about cleanliness or being organized. It can involve fears of harm, fears of thinking of taboo subjects, fear of losing control, and many other things. When my OCD began, I was really overwhelmed by those intrusive thoughts that were pretty terrifying. I felt compelled to pray and repeat the same sentences over and over again. I thought that repeating those phrases would help and would prevent disasters, as if I was in control of external events and factors. It really felt beyond my control. I'm quickly going to go through some common misconceptions about OCD. The first one being that OCD is about being tidy and neat. It really isn't only about that. Yes, some people who have OCD are very affected in terms of cleanliness and organization. It's a serious condition with a wide range of obsessions and compulsions. The second most common misconception is that people with OCD can just snap out of it. OCD intrusive thoughts cannot easily be stopped or managed. It really takes time to find the tools that can help manage them. Personally, for me, what really helped was to find a distance between my OCD and myself. What's really hard with OCD is that it's easy to think that it's a disorder that is defining who you are. One thing that really helped me was to label my OCD. I consider my brain or my mind as a computer, and my OCD is purely just a virus. It comes back from time to time, but it's just that. It's just a virus. It's nothing else. So this leads to my tip number 1. Accepting is your first step to healing. The fact of recognizing and accepting that you have a disorder and you have this, what we call the illness of doubt, just the fact of being aware of it makes a huge difference. Accepting it reduces the power of these thoughts drastically. My second tip is to not keep the OCD to yourself. With OCD, it's hard enough to be stuck in this never-ending loop of anxiety alone in our minds every day. It's really important to share these symptoms and these experiences with your loved ones, because it's really heavy to keep privately on a day-to-day. And be it OCD or anything else really, just sharing it to people really lessens the burden and can make you realize even more that you are not your OCD. Tip number 3, be patient and self-compassionate. Recovering from OCD is a journey. It's a journey that takes time and courage and patience. It's really important to be kind to yourself. And last but not least, my tip number 4 is to seek professional help. OCD is a serious anxiety disorder that may require professional help. There are treatments today like cognitive behavioral therapy or ERP that may be very helpful in treating OCD. I think there are still loads of misconceptions about OCD today, and I think it's important to shed light on different aspects of it that may not seem so familiar to people. I remember when I first started having OCD, I was extremely afraid. I was terrified even. I had no idea that the symptoms I had were OCD. I thought I was going mental. So with this video, I'm just trying to show anyone who needs this help today that you're not alone and you will manage this. You are not crazy. You are not your thoughts. With the right support system and treatment, you can navigate through it and you can still live a fulfilling life with OCD. That's it for today. Thank you so much for watching. I really appreciate it. If you know anyone who's ever experienced OCD symptoms, please share the video.